Hi students, this is Dr. Shomaker and I'm going to teach you how to use PowerChart when you're on the wards. So I've just double-clicked on this PowerChart icon and I receive a security warning. You want to click Permit Use. And in just a few seconds, a log on will pop up. If you don't see that, then go down to your toolbar and look for the lock and key icon. Click on that to bring up the Cerner Millennium login. So once you're in, you'll land on the Message Center page and you want to go to the patient list page. Yours will be empty to begin with and you need to populate your list. Click on this wrench for list maintenance to modify your patient lists. Now I have a lot of lists available and you will not. What you'll want to do is create a new list, and you'll want to create that new list by care team. And click Next. So you'll find that all of the different resident teams are available here. You'll pick the one that's most pertinent to you. So for instance, Team H, or Hospitalist Team 1 or Hospitalist Team 2. And then you'll click Next and Finish to allow yourself to see those lists. Now since I already have those lists available, I'm simply going to move them over so that we can work with them actively. And click OK. Now I can see those patients. You can use this bar here to sort your patients in any way that you'd like. I typically sort by location, just by clicking a couple times here. There we go. And same with list 2. And then we're ready to access a patient chart. So when you come in and you have a patient assigned, so let's say this guy, we'll double click on him to open his chart and you'll see a menu along the side. Your inpatient summary is the page that you should land on, but you also have available these NICU summaries and ambulatory summaries. Your page will not initially look like this. You have a lot of these little frames to choose from that show your primary care physician, weights and measurements, etc. And so you might want to rearrange it to show those things that will be most useful to you. You can do that by clicking these 3 lines here and clicking drag and drop. That allows me to move one thing compared to another. There we go. Just for example, there. So this view will show you your overall intake and output for your patient. This is going to be helpful for you to record. So for the last day, for instance, this patient had 660 mils in, 382 mils out. You can get more detail here on what that intake entailed. Looks like all of that was by mouth, and output was 354 of urine and a little bit of stool. Okay. Now we'll want you to give us a bit more detail than that. I would suggest going to Results Review and clicking on Patient Care Results, where you want to group this information to make it easier to see. And you can just use your navigator to start at the top. This patient is drinking all formula orally, and you can see that the feeds range from 15 to 100 cc's each. Enfamil Gentilese, and here's the calorie concentration. You'll use that summary information and this calorie concentration to calculate how many mils per kilo per day and kcals per kilo per day this patient took in. You'll want to do that on any patient who is entirely formula dependent. Other patients who also eat solid foods will have their oral solid food intake recorded here, and you can remark on whether they had a fairly good solid food intake or whether it only consisted of juice or ice chips, for example. You'll see that the nurses already calculate the urine output for you in mils per kilo per hour over the last 24 hours, and that's how you want to report it on rounds. Scrolling down, you'll also want to report to us the stool outputs, any emesis outputs or other outputs that are important for your patient. For instance, if your patient is here for diarrhea, you'll want to report how many stools they had in a 24-hour period and the overall stool volume in mils per kilo per day. That way we can track that from one day to the next. Here's a good example of looking at trends in your vital signs. So any vital sign values that you see in blue are abnormal. So these are too high here, and this number is too low. So just looking at the the most recent compared to about 24 hours ago, you can see which direction this patient is headed in. So the temperatures are actually a little bit higher than they were yesterday. Pulse rates are steady, and breathing rates are actually increasing. So that would be a bad sign, something to report on rounds. Respiratory rates between 48 here and then up to 64 currently. Blood pressure is commonly measured incorrectly in children, primarily because they cry and scream and fuss when they're being monitored. If you notice a lot of abnormal blood pressures in your patient's measurements, you may want to ask the patient's nurse to measure one manually in order to get a more accurate reading. Other information that you should look for here, especially if you have a child with a respiratory condition, is that respiratory assessment. So just scrolling down, you'll see that the nurses and the RTs record their respiratory assessments here. Currently, he's retracting with subcostal retractions. He has good aeration, and they're hearing coarse and fine crackles. You should report how much oxygen that patient is currently requiring and what the lowest SATs were. So for instance, this patient's lowest SATs were 85% at 8:20 in the morning, and he's currently in room air. These patients with respiratory conditions also often need to be suctioned, and that can be something that keeps a kid in the hospital even if he or she is on room air and otherwise doing well. So here you would report that this patient required suctioning 5 times over the last 24 hours and is having moderate to copious white thick secretions. That is a patient who's not quite ready to go home. Some of your patients may have bronchiolitis or asthma scores recorded, and you can scroll down to see those. Here we have a bronchiolitis score of 5, which is the lowest that an asthma or bronchiolitis score can be, and that reflects that they are having good saturations in room air, no subcostal retractions, and no tachypnea. When you're done gathering this data, you may want to check the patient's MAR. Let's use a different patient for this example. In this case, we have a MAR summary that shows us both inactive medications that are grayed out and no longer actively ordered, and then medications that are currently ordered, and these will show in white here. Just make sure to note that this is the older record and to the right is the newer record, so you will want to scroll all the way across to the most recent time frame. So here we are currently on May 3rd in the afternoon, and we have a patient who's on ceftriaxone and Vanc. You may want to tell me that he has received 2 doses of Tylenol today as PRNs. So your scheduled medications will be here first, followed by the PRN medicines below, and you do want to report those. Other information that will be helpful for you is the advanced growth chart. Here we're looking at a 2-month-old who is plotted on the CDC's WHO weight for age growth chart for girls, which is appropriate. Here's her weight. I can click on any one of these dots that are available, and it will show me the percentile for her, as well as the z-score, which is the deviation from the mean. Likewise, here is height. And just by using this menu here, you can look for head circumference, which should always be reported in infants. When you're getting to know a patient, especially someone who's come in through the ER, it would be helpful to start by looking at the summary documents. Someone who has come in through the ER will have a note here under KD, inpatient, ED, and day surgery. And the power note is what you want to look at. This will tell you why the child came to the ER, and scrolling down, what their exam and thinking was about this patient. This would be a good idea to read. Likewise, here in the summary documents, you can find a lot of information about this patient's past admissions, any consultations that were performed, and other places they may have gone. So our general academic pediatric clinic notes are here, as well as urgent care and any of our children's specialty group specialists. The surgical specialty group notes will be here, and you can also find radiology and pathology reports. Now in this case, our patient from day to day will also have some ancillary documentation, and you can only find that when you're in all documents. You'll notice for both of these that I am sorting these by type so that I can easily access what I want. The ancillary documents will here contain any notes from behavioral health, case management, and in this case, nutrition, which is what I'd like to look at. If your patient has any of these consults, you should check these notes on a daily basis. You'll find therapist notes here too. So in this case, our patient with an ulcer is having high protein diet, and you can just double check to make sure that we're doing everything that she would recommend and bring that up on rounds. So that should get you off to a good start, and I hope that helps.